Probably the most common comorbidity in people with schizophrenia is alcohol use disorder or substance use disorder, and that can complicate treatment in terms of interfering with adherence to the foundational antipsychotic, or the substances themselves may destabilize someone. You know, the issue about substance use and alcohol use disorders in people with schizophrenia is a tricky one. Are they using substances or alcohol to treat themselves, or is it does it contribute to the development of psychosis and so on? It's a pretty complicated story, but for whatever reason, the rates of using alcohol, using substances, smoking, for example, are higher in people with schizophrenia than the general population. There's a whole bunch of medical comorbidities that may also occur in people being treated with antipsychotics. People with schizophrenia generally are more prone to develop metabolic problems anyway, and antipsychotics can accelerate that. So if antipsychotics are associated with weight gain for an individual person, for example, they become insulin resistant sooner and may have problems with their glucose. They may have problems with their lipids, and this increases the risk of cardiovascular disease, a heart attack, stroke, and that sort of thing. You know, the other concern about people with schizophrenia is the risk of suicide. And schizophrenia is potentially a fatal illness because of suicide. And there was one intervention that was tested and approved by the FDA specifically for people with schizophrenia or schizoaffective disorder who may be suicidal, and that's clozapine. And we often forget that that's one of the indications for clozapine. We usually think of it as just for treatment-resistant schizophrenia, but it's also quite helpful for those who have problems with suicidality. I think the most important thing to remember in treating people with schizophrenia is that it's important not to lose hope and not to display therapeutic nihilism. There's always something new to try, something new to think about, and I think it's worthwhile continuing that effort. And instilling hope is one of the things that we need to do for our patients.